As always, time is too short when you got into a breakout session, so maybe it's a lesson learned. We were hesitant to organize this during our online meetings, but I think also Mario kind of drove this idea, and I do appreciate it. I appreciate it yesterday and also today, even. So in the future, we might foresee a little bit more time. So, but it's time now to get the feedback of the discussions. I don't know which group wants to volunteer to start.
So we discussed something, some new things which we discussed, which we would like to share with you. Is that Alex present us the WHO document, its interim guidelines of maintaining essential health services, where explicitly there are some paragraphs very important for the HPV community, because they show the WHO commitment for screening. They put some criteria. They're promoting self-sampling for HPV, facilitating home testing, and also the distribution through the pharmacies. They prefer single visit approach to screen and treat precancerous lesions, and would like to have prioritizing access to the woman living with HIV. So Alex will share this document with you later on. Then we discuss actually the whole chain, because we have some people from laboratories, some clinicians here. We actually discuss the whole chain of the screening, which starts from uh, starting promoting idea of HPV based testing above all other testing approaches, screening approaches. Then how to deal with the different scenarios around the world, what kind of HPV test and approaches we will use. And then the something which we discuss a lot, it's how to actually secure the affordable tests for all countries, not only countries, low-income countries, but also countries even inside the members of the European Union who have very high incidence of cervical cancer, and maybe start to use this support from WHO, but try to find the money and lower the price through the large tenders, which can be even run by European Commission, not necessarily by Bill Gates or the other non-governmental supporting organizations, but also by governments. And we developed some ideas how it's possible, because we have strong arguments that this is working well. We already mentioned today the case of Netherlands. There's a very successful public tender in Turkey, which reduced the price of the HP test substantially. There is several.
Sì, grazie. Stavo ancora lasciando l'altra riunione in
Paolo, please mute yourself. Paolo, thanks. Okay, and then we also, there's also very successful public tenders for different tests issued by European Commission. And then we also discussed what to do with the screen positive individuals. And then Murat, tried to explain us that now all gynecological obstetric societies are now looking forward to the global coalition, when they will try to provide the minimal standards for surgery of already developed cancers identified through the screening, which will be tailored based on the workforce which is available in different parts of the world. Because what actually Margaret's put in the chat, last chat when we were together last time together, everything worked well in COVID more or less, except of the working force. I mean, clinicians, someone taking care. So there are huge limitations across the world there, and we need to work in parallel with improving the screening. We need to build a infrastructure on the clinical part. I mean, and try to lower standards which are still acceptable, but not necessarily always, for surgical purposes needed highly trained gynecological oncologists, because otherwise this will not work well. and also simplified the treatment of the precancer lesions in the way that this will be delivered by non-medical doctors. So this was the summary of our discussion. So we try to cover all this chain, which is quite complicated, but I hope you understand what was the basic idea.
Yes, I did. Thanks, Mario. Shall I go then? Um, so we have about 5 minutes left of the whole thing, right?
Yes, please.
All right, so our group focused, of course, on HPV vaccination, and one of the sentiments we voiced right at the outset was the fact that if you look at the two primary tools, vaccination and screening, the efforts expended on vaccination would be much more rewarding than those on screening. There's a general perception that the world has been more successful with vaccination in general. Even low-income countries have had a much better time in terms of public health delivery of vaccination and deploying that, thanks to the WHO and the EPI program and other things which taught countries how to do that. So the energy invested in vaccination should truly be invested in. We had conversations and discussions about gender-neutral vaccination versus girls only. One of the points of concern for the group was, of course, WHO's concern about vaccine supply, the appreciation of the fact that the pandemic also had an impact on school-based delivery of vaccination. There was a perception, and Nubia voiced that there would be perhaps we should do more or less the same as Mario did for his survey of the impact of pandemic on the world of screening. What would be the similar impact? And I know there are people who are doing such surveys in different countries, but it would be nice to have that on an international scale. And there are lots of people doing modeling on that end as well. We had one company represented in our group. Merck was there, and Merck is trying to meet the demands. Well, actually, they are meeting the demands and the challenges because of the pandemic. Even though Merck, as you know, it has been highly publicized in the media, they are lending their facilities to the production of the Johnson vaccine, but that's not going to affect production of Gardasil 9. So solutions with respect to ways going forward could draw upon clever ways of combining vaccination and screening. HPV faster was one of the pioneers on that. Xavier Bosch, as you know, was a proponent of that. Variations of HPV faster, perhaps for HIV, women living with HIV in Africa would probably provide good dividends going forward. The overall understanding and looking at cost effectiveness also was a major point of concern in our group. We need to have a community of modelers who's more responsive to what research is providing us in terms of ways going forward, so that we can actually inform policy making with very clever cost effectiveness analysis. We're taken by the fact that Mario mentioned in his previous talk that there will be a world in the future with €1 per HPV test, but one needs to consider the cost of deploying HPV testing, and the same thing for HPV vaccination. Eventually, we would have a more reducible, a lower cost of HPV vaccination, which eventually would impact on the overall cost of vaccination. And this led to discussions, of course, of single dose versus two-dose HPV vaccination. And there was a general sentiment in the group, despite talks yesterday, that we're still in suspended animation between whether we're going to go one dose versus two doses as the final solution. There's some good news on, for instance, Sinovac in China, partnerships with GSK. Eventually, we're going to have another 9-valent vaccine, which could relieve the pressures on supply of HPV vaccination. Much discussion on emphasis on HIV, women living with HIV. Much of what cervical cancer exists is happening in vulnerable communities in sub-Saharan Africa and other places. And there are very clever studies that are being being conducted now. Maribel Monte, we heard also from Armando in our group about these studies looking at combinations of screening and vaccination to screen women post-vaccination, women with HIV, and those who eventually persist with the infection even after vaccination are those prevalent cases that need attention and need to be treated. So clever ways of deploying research on that would be very promising on that. We also need more research on hesitancy, vaccination hesitancy, and communication. Many in the group voiced the excitement that the world of the pandemic of COVID-19 eventually created a perception by the public that vaccines are an important tool. So we should capitalize on that opportunity and do more on that end. I think that's, and the final point here is that in Europe, particularly, the pandemic taught European countries to be more centralized in procurement of tests and vaccines. And this should be perhaps a good roadmap for other countries, other regions, such as the revolving fund and the Pan American Health Organization, which helps to centralize procurement. So I think I covered everything. Anyone in my group who would like to add?
I had a general comment, if I could just say briefly. It seems to me that one of the big challenges is, can we latch onto the back of the COVID thing, which has generated all of this resource in dealing with that disease, and try to get the people that generated that resource to redirect it to HPV once COVID sort of settles down. It seems to me we need a political will, not just a scientific will, to make this happen.
Yeah, we discussed that in our group. Yeah, that's a great point, Jack.
You know, maybe this society should sort of somehow establish a kind of political wing to sort of try to raise the profile of the whole area as well.
Is Margaret there?
One of the things we discussed yesterday was that it would be useful to write it down, rationalize that concept, and disseminate it widely, and start creating a state of opinion in which the value of vaccines is upgraded, the pressure to vaccinate is much more reinforced. It is a way of mitigating the impact of the anti-vaxxers. And in a certain way, that should generate additional support for research and for implementation of HPV vaccines, eventually HPV screening as well. But if there is a moment in history where the world is listening to the word vaccine, is now. And we already have 12 years of international examples of introducing HPV vaccines, and we do have proof of prevention of a major female cancer. So we have the ingredients. We need the lobbying and the ability to interact with politicians. But to start with, I think it would be useful to write it down, and as a group we can generate a document that shouldn't be too long. It should be a couple of pages outlining the situation and identifying the points in which we would like to receive additional attention and support.
That seems a great idea to me. I just wonder, I mean, at one stage there was this idea of, vaccinate the children and screen the women and the mothers at the same time, and we just link it all together into one big project that does both of these things.
I remember when you said that, Jack, and it was right in the beginning, even before vaccines were licensed, but we knew it was promising. I remember you saying that in a conference. Another thing that's analogous to
mother as well.
Yes. One thing that's analogous to what Javier just mentioned is that the world is also more receptive now. At least the world of health sciences is more receptive now than ever in the past to elimination of disparities. And so the same way that there is a lot of news right now about vaccinating COVID vaccination for the rest of the world, because right now high-income countries are hogging all of the vaccine supplies. and that this is leading to a commotion in scientific circles. That same commotion should also be provoked in the HPV field, because we do have already a major disparity, and which needs to be rectified. We should also capitalize on that, not only the goodwill because of people, the public perception of the importance of vaccines, but also the public perception of eliminating disparities. Look at all the Black Lives Matter and all of those movements that are initiating all over the world, and all of your institutions now having to take into account equity, diversity, and inclusion principles in everything we do now in research and academia.
Okay, thank you all very much.